Hi, in this video I'm going to be talking about exercise if you're going through breast cancer and its treatment. What good is it? What type you should get? Are there any risks? So I'm just going to start in with exercise in general. We talk about exercise as being protective. Exercise as being a way to protect us from heart disease, a way to protect us from depression, a way to protect us from Alzheimer's, a way to lower our blood pressure. So in general, movement, which is what I prefer to call it, movement is really good for us. In fact, there's a new study that came out showing that if you have osteoarthritis of the knee, it's actually better to be active than it is to try to protect the knee by holding it still. So pretty much anything we say about exercise goes for pretty much any condition. There are some rare conditions that you would know about if you had them where you have to limit exercise. So I'm going to talk about exercise just as generally as I can. The one thing I want you to do is not feel that you in any way caused your breast cancer by having a less active lifestyle. Not everybody is able to move a lot. You might have a disability that makes it hard for you to move. You may work 3 jobs that are sedentary that make it hard for you to fit in time for formal exercise. You may hate exercise. So please don't leave this video thinking that somehow you're responsible for your breast cancer. You're not. It's slightly protective, meaning it reduces the risk a little bit, but in any given person, we don't actually know why you got breast cancer. It's not right to tell people that in any way they caused their cancer. So with that aside, let's talk about the benefits of movement. And if it's okay with everybody, I'm going to call it that. There are all different kinds of movement, right? There's lifting weights, which is great for our bones. There's cardiac exercise, cardio exercise, where you move as intensely so that you can still talk but not sing. You don't actually have to check your heart rate and do this calculation with your, a certain number minus your age. If you can talk, you might want to increase the intensity a little. I mean, if you can sing, you might want to go up on the intensity a little bit. If you can't talk because you're so winded, that's probably too intense. You want to be somewhere in between. So when my husband and I go walking in the morning, I try to make sure I'm walking fast enough I can't sing. But if I were to find myself breathless, I would slow down. I hope that makes sense. So that's exercise that we call cardio exercise. And it's very good for endurance. It's very good for preventing atherosclerosis of the heart and the brain. It's very good for your overall fitness, and it can help us maintain our weight. So I'm not going to talk about exercise for weight loss. It's really hard to lose a lot of weight by exercising without making other changes, but it can help us maintain our weight. It also helps with other short-term things. So we all, think about down the road. That's really important. But right now you're in the here and now, and you've got a lot going on. If you want to learn about the different types of treatment that might be part of your treatment plan, you can go to Yerbba.com. So your plan's pretty involved, and you want to know what kind of exercise should I be doing. I'm going to be talking to the average movement person, and then I'm going to talk to somebody who really hasn't moved a lot, and then to somebody who's an athlete. So let's start with a sort of typical person who has breast cancer. Some type of movement every day will be really good for your mood. It will be good for your joints. It will be good for your spirits. It will be good for you socially if somebody wants to help and they want to know what they can do. Say, come over and walk with me, or sit with me while I use my bike. Encourage me to stay active. We don't want to lose the gains we've made by being active, just sort of regular active. If you've been sedentary, and that applies to so many people in this country and in this world, again, don't blame yourself. There are a lot of things that get in the way. There are neighborhoods where it's not safe to walk, for example, because of unsafe sidewalks. And there are neighborhoods where going for a walk, going around the block is 4 miles. So it's not as easy as it sounds. But you can just increase your exercise, your movement a little bit. You can do things like park a little further from the building you're going to if you go shopping. You can go up and down stairs a couple times a day. This will actually help you maintain wellness during treatment. And although the last thing you want to be told when you're tired is to exercise, this is one of the few things that has been shown to improve fatigue during treatment for breast and other cancers. I'm going to repeat that. I think it's really important. Even when you're fatigued, some sort of movement is important, especially if you can get some natural light. Go outside and do something 10 minutes a day. This is the one thing that has been shown to improve fatigue during breast cancer and its treatment, as well as other cancers. It's been studied the most in people with breast cancer. Other types of movement or exercise would be to stay active. If you've had surgery underneath the arm and the axilla, you don't want to stiffen up in the shoulder. We've covered that in other videos. But you want to maintain mobility in that arm and shoulder. It's really important for lots of reasons. What about swimming? Yes, if you love to swim, you can keep doing that. You might be advised not to go swimming in the middle of your treatment cycles because your counts are low. There's actually no evidence that that's necessary. So if swimming is your form of exercise, I would recommend keep doing it. I have a patient where swimming is her therapy. It's good for her head, it's good for her body, it's good for her shoulder and lymphedema. So, she abides by this and swims as much as possible. If she has a choice between take a nap and swim, she'll usually go swimming. All right, now I'm going to talk to people who are athletes. You're training for a marathon, you're diagnosed with breast cancer. Fitness is part of how you cope with the world. I would say talk to your medical team about this because you're going to get a lot of mixed information. And I would actually recommend that you see an expert. You can see a physical medicine and rehab doctor who will help decide what kind of exercise is okay for you. And they can actually work with you if you're still training for something to be able to stay as active as you can and not get discouraged, right? You don't want to set yourself up for failure. You also don't want to limit yourself. So there are a lot of people who are athletes. This goes back to, did you cause your cancer by not being athletic? No, you didn't. I've had marathoners come in with breast cancer, and similarly, being a marathoner did not cause their breast cancer. But if that's a big part of your identity, retaining your health may actually go into what kind of treatment you get. We give chemotherapy sometimes, 2 drugs at a time, followed by 1 drug. If that is a regimen that you've seen pop up on your treatment options on Yerbba.com, so AC followed by paclitaxel, we can actually spread those drugs out so you get 1 drug at a time, much less fatigue, much less anemia. So these are some of the tricks of the trade an experienced oncologist can help you with. And an experienced oncologist doesn't necessarily mean an old oncologist, right? It can be somebody just out of training, and this is all they're doing is breast oncology care. So lots of options. I know I've covered a lot. I've covered the types of exercise, the importance of exercise or movement, different strategies if you're a non-mover, if you're somebody who's kind of average, and if you're an athlete. I hope it's been helpful. If it has, please click like and subscribe. What that does is it helps YouTube help other people searching for the same things find this video, and people facing the same kinds of questions as well. And remember, you can go to Yerbba.com to learn more about treatment options that might be part of your treatment plan.